Tuesday, April 21st, at ArchCare's Calvary Hospital in the Bronx, the Interfaith Conference for Palliative and End-of-Life Care took place with nearly 100 in attendance.
We thought it was important for Calvary to host this Interfaith Conference because of what we do. First, we are part of ArchCare, which is the health ministry for the Archdiocese of New York. We're a religious institution. We accept all patients of all faiths and denominations here at Calvary, and we're one of the original sites for palliative care in the country. So explaining what we do and how we do it to those religious leaders in our communities, it's important for us, it's important for them, and at the end of the day, it's important for the patients and their communities.
Medicine is another form of church. We want to be healed, body, soul, and spirit. And all of us are unique. And all of us have different goals of care and what's important to us. And we get to live our best selves when we know that those who are caring for us have our priorities in mind as opposed to what their priorities are. And, medicine isn't just about curing, but it's always about caring. And that's why palliative care is so important.
ArchCare is a leader. Calvary Hospital is a leader in providing palliative and end-of-life care, high quality, loving, caring end-of-life care to their patients and to their residents. They practice clinically competent medicine with kindness, communication, and non-abandonment, and really treat their patients not only with competence, but with kindness and love.
The ideology at Calvary is that end-of-life care encompasses all forms of care: mental, emotional, spiritual, and physical. Palliative
care recognizes that patients with advanced disease suffer in more than just physical suffering. They suffer emotionally, they suffer spiritually, and they suffer with family pain as they approach the end of life. Spirituality is a very important component of palliative care, and it's so important. It's a pleasure for us at Calvary Hospital to help educate spiritual interfaith leaders with the understanding of what palliative care is, and with helping them in their role in the delivery of palliative care to patients and families in their communities.
This conference took place at a crossroads in New York State as the Medical Aid in Dying Act, or MAID, goes into effect on August 5th. One of the biggest talking points at the conference was focusing on using this act as an opportunity to show patients a more comfortable and individually focused end-of-life plan, rather than going down the route of physician-assisted suicide.
As unfortunate as MAID is, I think it's going to give us some incredible opportunities to learn how to be church and how to be disciples and how to be Jesus in new and important ways. I think it will give us an opportunity to, again, to be able to have conversations with people, keep asking the question why, and then the question how. How can I help you? How can I care for you? How can I love you? Because someone's dignity, of course, doesn't end just because they're older or because they're disabled or because they have a terminal illness.
To learn more about ArchCare's work in end-of-life care at the Calvary Hospital System, head over to their website at archcare.org/end-of-life-care with dashes. And this past week, bishops from the New York State Catholic Conference published a pamphlet discussing physician-assisted suicide and how to remain in Catholic social teaching as the MAID Act goes into effect soon. For the Good Newsroom, I'm Patrick Grady.